And we'll get started. So tonight we're just going to talk about complementary and alternative therapies. Um, so really what we're talking about is Western versus Eastern medicine. Western medicine is all based upon allopathic and biomedicine, looking at the sciences and does it change cellular activity and those kinds of things. And that's really what Western medicine is about. So, um, but what Western medicine doesn't treat is it doesn't treat chronic pain. We don't treat stress-induced illnesses, and we're really poor at improving quality of life and a person's well-being. Whereas Eastern medicine is really about being natural and holistic. Um, we talk about yin and yang, and we talk about Chinese therapy and all of those kinds of things for years. And I really think over the past 5 to 10 years, it's really taken a stake in medicine over here, and we're seeing it become more and more popular, and people are being more receptive to those therapies. And really, we're beginning to incorporate them into how we practice. It has a desire for less invasive therapy. Um, People seek Eastern medicine when they feel a lack of satisfaction with biomedical treatment. So they'll have gone through Western medicine and they feel like they didn't get any help, and so then they'll fall back onto the Eastern medicine. We know that really a combination of both treatments improves health. So using both of them are very, very important. And we're seeing a bigger increased research based in Eastern medicine, where we didn't have that 5, 10 years ago. So when we talk about evidence-based research and changing therapies and changing modalities and level of cares and those kinds of things, we're beginning to see Eastern medicine take a creep in that, only because we see we're doing more and more studies, and we have more and more research to back those therapies up. So when we look at complementary versus alternative, so complementary therapies are really therapies that are used in addition to the conventional Western medicine. So somebody who has chronic low back pain, they may seek a medical doctor to treat for, different kinds of muscle relaxants and NSAIDs and, maybe some opioid use. But then they'll also use chiropractor and massage and, some of those kinds of Eastern therapies as well. So that's really complementary medicine when we're seeing it used both medicines at the same time. One complements the other. Whereas alternative therapies really become the primary source of therapy. And people just use only alternative therapies. So I think probably you guys have a bigger stronghold and probably a bigger, history in alternative medicine than I do, because really that's what the Native American culture is based on, is alternative therapy. The medicine man and the herbs and, all of those kinds of things. That's really alternative therapy. So, really the Native American culture is really based upon that Eastern therapy of medicine and not using the traditional or conventional medicine. So, we see a lot of that. And, working at IHS, I see a lot of that being used and being able to complement. It may not necessarily replace everything that I do as a provider, but I certainly don't dismiss those practices and those treatments that people choose to use. And, I think that we're seeing that there's more and more research being based upon that, and that being a valid, therapy or alternative to Western medicine. So when we talk about complementary and alternative therapies, so there's different kinds. And when we talk about them, we talk about manipulative based therapies, mind over matter interventions, movement therapies, and whole medical therapies. That's very important to remember because these therapies are classified into groups. So if we think about it, just as we think about medicine, we have NSAIDs and opioids, and we have um, neurological medicines, so we base therapies. Well, the same thing happens in complementary or alternative therapies. So like manipulative or body-based therapies, that's like your acupuncture or your acupressure, your chiropractor or massage. So it's really based on manipulating that body and trying to find that holistic or bringing things back into the center of um, and finding that peace. By mind over matter interventions, these are like the biofeedback. So we talk about physiological control, and psychological things, where people are doing breathing work. You think about meditation, um, music therapy, Tai Chi, where people are moving and synced in those slow types of motions, that meditation, that moving meditation, and yoga. Those are all really mind over matter. So we're really, taking people back to being able to think about, if you become at peace with your mind, you become at peace with your body, and you can heal your body through that peace of mind. So we know this is true, right? We know monks have done this for years. We know the Chinese culture has done this for years, right? They don't believe in modern medicine. They've used these kinds of things, and we know that there is a truth to that. Some of the different movements and the different things that they do, it's really, you think about how can they do that, you know, but it's really a mind over matter type thing. And that's these interventions that we talk about. Yes, Colby?
Um, a while back, I was just going through some troubles, and I went to Southern Plains Behavior Health in winter, and it was like an outreach program in Gregory. And one of the first things that they actually taught me was meditation, and and I that kind of shocked me. I expected like, here, take these pills, but instead they were like, let's go at it at a more like natural approach, see what we can do. So that was something.
Absolutely. And there's a lot of research out there. We think about the world that we live in, and we talk about, Eastern medicine really being about, reducing illnesses versus, um, grasping stress, and you think about that, how many illnesses do people have that are really manifested because of stress? I see people with low back and high back pain. I see people, with depression and anxiety and, just not being able to deal with the stresses of the world and not having those coping skills and really just coming back to peace being within us and finding, really focusing on the things that matter in life and not about all those little menial details. But we all get caught up in dealing with trying to keep up with the Joneses, right? If my neighbors have it, then I have to have it. And then that causes more stress and it causes more anxiety. And all of those things cause lots of physiological damage. I see people with irritable bowel syndrome all the time. And I really think irritable bowel syndrome is stress related. I wish I could take those people back and really let's deal with the stress of this, and then we probably can take care of irritable bowel syndrome. Or I think about people, a large amount of the people that I treat with insomnia, it's stress related. That's why we use amitriptyline. We use amitriptyline for sleep. What we're really trying to do is decrease people's stress. And this insomnia is just a side effect of that. So we find all of those kinds of things. And I think finding that peace within us and being able to really, there's a lot of stuff with mind over matter. I think about people who have cancer and, those people who have a good attitude and they have a positive outbeat, I'm going to beat this, things are going to be okay. Those people do better than those people who are like, whatever, I'm doomed, blah, blah. You know what I mean? There's a lot of truth behind that. Western medicine can't back that up. We can't back that up with research, but we know that having a positive attitude is vitally important when dealing with cancer and some of those long-term chronic conditions. So there really is a lot to it. So when we talk about mind over matter, we're talking about those biofeedbacks. We're talking about breathing and meditation and yoga and Tai Chi, all of those kinds of things, really focusing on, becoming more at peace with your mind, and that peace of mind will then bring peace to the body as well. Movement therapies, this is where Pilates and dance come into play. I think it's funny. I mean, when you think about, did you guys ever watch Grey's Anatomy? Right? I mean, so what happened when Meredith and Christina, what happened when they got stressed? What did they do? When they had a bad day, when things went wrong,
I mean, they would like vent to each other.
they would always dance it out, right? That's what they did. We're gonna dance it out, right?
Other dance parties, crank up the radio.
Yeah, we're gonna dance it out, So I think really that was, when I look at Grey's Anatomy, I really think that was really kind of bringing that Eastern medicine into my generation of people, that there really is something to this. And people who do Pilates, I don't know if you guys know people who do Pilates. I know people who do Pilates, and it's like, man, they're always so focused and so centered when they do that. It's really kind of crazy. And then, I think of the body movements they do, and their ability, their range of motion, and all of those kinds of things, they're really kind of able to take it to the next notch, to the next level. And it kind of really surprises me, because I even see people who are heavy like me try to do Pilates, and it's like they have more, they're limber, and they've got more, there's something to this mind thing that they have going on. There truly is, because I could never do that, and I'm just as heavy as they are. But I could never do those movements. So I think there is something, because it centers you and it focuses you and it makes you come back to that. And then the whole medical system, this is really the homeopathic system. And homeopathics is a huge thing right now. It is a huge thing. You think about aromatherapy that's out there, herb therapy, all of those kinds of things. That's that homeopathic remedies. And in your book, when you go to Perry Potter, it's in chapter 33, page 3, or table 3. There's a whole table on homeopathic therapies. So make sure that you read that and review that, because that's important. When we look at whole medical systems, we look at the Native American tradition, sweating, purging, herbal, homeopathic therapies. So it's really looking at that whole body systems and really incorporating lots of different things into that. And then traditional Chinese, such as the yin versus the yang, and then, cupping. Have you guys ever seen anybody do cupping?
The thing.
That's where they put that flame in the cups and then they put it on their backs.
Yeah, and that's that cupping therapy. So not uncommon to see, if you're working in different areas, if you are working in an area with lots of Chinese people, you'll see kids who have bruising from cupping. We seen cupping at cupping being used at the Olympics.
Yeah, Michael Phelps.
All of those swimmers had all of those bruising, and it was from cupping. And that goes back to this Chinese therapies that were used. And I really think that there was cupping in the Native American culture too. I can't tell you for factual, but I think cupping was used previously in the Native American therapies as well at one point in time. But cupping is a big thing in the Chinese therapy. We see that a lot right now. And you've seen cupping being used at the Olympics as well to help with muscle tightness and muscle soreness and keeping, people limber and those kinds of things. So cupping is a big deal. You do see it. So one of those things that, when you're doing assessments on people and you see those kinds of bruising, you need to make sure that you're asking about what alternative therapies they use, and are there other practices that you use, and those kinds of things, because otherwise you can get yourself into trouble. Not so much in the Chinese therapy, but you'll see it like in the Vietnamese, they'll have cold versus hot. So if you do something cold, you have to have something hot with it. And that's kind of that balanced homeopathic therapy where, if you eat something cold, you have to have something hot with it at their meals. And that's just kind of that belief system they have. And so, and that's more in that Vietnamese culture and those kinds of things. So, really is a lot to complementary therapies and alternative therapies, but make sure that when you're studying, the different things, manipulative versus mind versus, because you'll be asked to put together which therapy belongs in which group. Okay. So integrative nursing, and I really think that's where we're at today. You can have them. Oh, there's the cheese. So we're at integrative nursing and integrative therapies, and this is really where we need to be at. And this is a way of being, knowing, and doing that advances in healthcare, in appreciating those alternative and those traditional um, emerging therapies that are coming back. So, just because they don't choose Western medicine and the therapies that we have going, our natural or conventional therapies, we can't be passive or dismissive. I don't know if you guys have ever been part of it, but man, there's nothing better to me than massage. I mean, I feel like $1,000,000 after a massage. I just feel peaceful, and so there is something to that. The acupuncture. Never done that before in my life, and did that about a month ago, and man, I cannot believe how different I felt after it. So there's a lot to that, and I think integrative nursing is really being able to open up our mind and accepting those kinds of therapies. And you guys being Native American, you're way more advanced in that than I am. But just making sure that we're looking at those therapies and those traditions that people do, and that does bring them can be it helps with their well-being and with their health, and we can't be dismissive of those therapies. And we're really kind of beginning to accept that. I know there used to be, like, if you went to the chiropractor, medical doctors would tell you were fools and all this kind of, I mean, that's just kind of how it was, right? There was this big rift between that. And really now we see them working together more and more. So, I mean, just you look at kind of how things were, and we're becoming more acceptive of them in Western medicine. And really, that's all I've got, guys, when it comes to complementary and alternative therapies. Like I said, the big thing for you guys I want you to remember is you guys need to understand the difference between alternative and complementary. So alternative is when, they do not choose Western medicine. Alternative therapy replaces Western medicine, whereas complementary is when they do both. Okay. And then I'm making sure that you're able to, hey Joe, I'm making sure that you're able to distinguish between manipulative versus mind and body movement, and then the whole medical systems, because you'll be asked to put those all together, which therapies go into which group. So making sure that you're taking a peek at those and kind of studying that. But really, that's really all I have on on those alternative health and all of that stuff that's out there. I do want to go over those questions. Were you guys able to do those?
Yep.
All right, let me just bring them up here so we can go over them. It's still upset. Okay, so just a couple practice questions for us to go over. The first question was, a licensed practical nurse is planning the client assignments for the day. Which of the following is the most appropriate assignment for the nursing assistant? A client who requires wound irrigation, a client who requires frequent ambulation, a client who's receiving continuous tube feeding, or a client who requires frequent vital signs after cardiac catheterization. Which one is
B.
most appropriate for the nursing assistant?
B.
B. Okay. Why did you not choose D?
Because just, with I just think that should be in LPN, just because you don't, with the cardiac, you just want to make sure that like the rhythm is on track, and maybe it's just someone that's more not maybe knowledgeable with the
Absolutely.
cardiac system.
Absolutely. I agree with that. So somebody who just underwent surgery, they're coming back to the floor, that is not considered a stable patient, right? And we said the other day that nursing assistants should do vital signs on stable patients. Somebody coming out of surgery is not considered stable. Okay. The second question, a nurse is assigned to care for 4 clients. Which client should the nurse check on first? A client on a ventilator, a client in skeletal traction, a postoperative client preparing for discharge, or a client admitted to the previous shift who has gastroenteritis.
A.
Probably your one on the ventilator, right? Because we go back to ABCs, right? There you go. They rears its ugly head. A nurse is delegating the ambulation of a client who had knee arthroplasty 5 days ago to an AP. Which of the following information should the nurse share with the AP? Select all that apply. The roommate is up independently. Is that important for them to know?
No.
Not when you're talking about your ability to care for that patient, right? It doesn't matter whether I know what everybody else is doing. If I'm looking at caring for this one patient, I don't need to know what the roommate is or isn't doing, right? That's basically what they're saying. Important information when you're talking about that patient, but not when you're talking about the other patient. The client ambulates with his slippers on over his anti-embolotic stockings. Is that important to know?
Yes.
Yeah.
Absolutely. It's a safety concern, right? I mean,
Right.
that's an anti-slip issue. The client uses a front-wheeled walker when ambulating.
Yep.
Yeah, that you should know that. The client had pain medication 30 minutes earlier.
Yes.
Yeah, because that could change their mentation. It could change their their stability, all of those kinds of things. The client is allergic to codeine.
No.
As an AP, that really doesn't matter to you, right? You're not going to give them codeine. It's important to know for you as an LPN who's giving meds, but it really isn't going to impact that assisted personnel, really, right? So you could say that one would be a no.
Well, wouldn't it be if codeine that makes them sleepy though, wouldn't it? When they mess up their balance, so the AP would know to watch
But
him closer.
if you had codeine, if you gave them codeine, that would be important. But just that they're allergic to it and they can't have it, really, it doesn't change your job, right?
Yeah.
It's kind of a trick question. I mean, it makes you question that, right? It does. It really kind of does. But as an AP, that's not going to impact your job, what you do with them, right? But if you were giving them pain medication, absolutely, but not what they're allergic to, because they're not going to have those meds. And then the client ate 50% of his breakfast this AM.
No.
What is the AP in charge of?
Walking.
Intake and output, right?
Oh yeah.
Oh, true.
Absolutely. That's one of their jobs is intake and output. So them knowing that they ate 50% of their meal that day is important to their job as an AP. Kind of tricky, isn't it?
Yeah.
That's why I want to practice these for you guys.
Very Cody, on Monday, we were all stuck on that one problem, and it gave us more information than we needed. It was just
Right.
how many mLs for that day, and it said, like 80 mLs per kilogram or whatever, and it just went on this whole thing, and it stumped us for like about maybe an hour. Us two, Joe and Bree. Even Bree was stumped on it too, and then Joe finally figured it out. We were reading too much into it, so.
Yeah, and it's so important. That's why sometimes you just got to go back and read just the question. Don't read everything else. Sometimes it's important just to go back and read the question and then read everything else, because a lot of times you're given more information than you need, and then you're trying to figure out something you shouldn't even be trying to figure out because that's not what the question asked you. So sometimes just going back and reading the question will help refocus everything else for you. So a nurse is preparing an in-service program about delegation. Which of the following elements should she identify when presenting the 5 rights of delegation? Select all that apply. Right client?
Yes.
Don't get confused with the 5 rights of administering medication.
Right patient, right time, right dose.
That's the 5 rights of medication.
Great circumstance. Right. Hang on, let me get back to my worksheet here. Right direction, communication.
Yeah.
Right supervision, evaluation.
Absolutely. So it's B, C, and E. Right client, right time. Those fall under your 5 rights of medication administration, right? So that kind of begins to trick you a little bit, right? But when we're talking about delegation, the 5 rights of delegation, it's the right supervision and right evaluation, right direction and communication, and the right circumstance. Those are the rights of delegation. A nurse manager of a medical surgical unit is assigning care responsibilities for the oncoming shift. Okay. A client is waiting transfer back to the unit from PACU following thoracic surgery. To which staff member should the nurse assign this client? The charge nurse, an RN, an LPN, or an AP?
LPN.
Wouldn't it be RN because they're coming from the PACU, so they would want the one with the most experience, or would it be the manager?
No, the case manager doesn't see patients. They're just
But
managing all the nurses.
Charge
if
nurse.
it's already been assessed by a registered nurse, can LPN do the follow-up?
Look back at what kind of surgery they just had. Thoracic surgery.
Oh.
So that's a high respiratory. If you have a thoracic surgery, respiratory, because you got to think about what's the outcome. What could happen if things go wrong, right? And so you have a patient who had thoracic surgery. So now you got to think about airway and all of those kinds of things. So it would be an RN. An RN is the most appropriate person to assign to that. Okay. Now, if it was just somebody coming back from PACU from abdominal surgery or colonoscopy or those kinds of things, then yes, an LPN is more than qualified to take care of that. But the fact here, this is a thoracic surgery, so it changes the situation, the intensity. because because part of that delegation component was being able to think about what could the outcomes be, what could the possible problems come up, and making sure that you're assigning the most appropriate person to deal with that. You had a question, Joe?
Yeah, where did you guys get these questions from? Did you send them to us, or?
Yeah, I sent them with my PowerPoint last maybe Saturday or something.
Oh, Joe, it's the one that Bree gave us on Monday.
Oh. Did you already go over this, Melody? I'm sorry.
Yep. And I recorded the lecture, Joe, okay?
Okay. All right.
Okay. So do you guys have questions about that thoracic surgery one and the assignment? Okay. Got it. So just make sure that you look at the type of surgery, because you'll get those little cues in there on that as well, okay? So a nurse is caring for a client who reports back pain and tells the nurse that a friend has recommended a chiropractor. She asks the nurse what a chiropractor does to relieve back pain. Which of the following responses by the nurse is most correct? Chiropractors use their hands to manipulate the spine to treat the back pain. Chiropractors insert needles or put pressure along meridians in the back. Chiropractors use herbal remedies to balance the energy fields in the back.
A.
A, absolutely. A nurse is reviewing complementary and alternative therapies with a group of nursing students. The nurse should classify which of the following as a mind-body therapy. Select all that apply.
Did you say mind body?
Mind over body. Yep. Mind versus body.
Just on here it says mid body, so I was like, what?
Oh, sorry. It should be mind. Sorry.
Okay. Yoga.
Okay.
Acupuncture and therapeutic touch.
Okay. Everybody agree with that?
Or art too. Art therapy.
Is art therapy going to fall under that?
No. No. Oh, biofeedback.
Okay. Biofeedback, yoga, therapeutic touch, and acupuncture or acupressure. Okay. So just make sure you go back and all of that is listed in that ATI module as well, the ATI book. So make sure you review that. A nurse is coaching a group of nursing students in learning to use complementary and alternative therapy so that they can incorporate it into their practices without the need for specialized licensing or certification. Which of the following should the nurse encourage the student to use? Select all that apply. Guided imagery, massage, medication, music, or therapeutic touch.
Meditation. Music therapy. And guided imagery.
Okay. Is there any more?
Therapeutic touch.
Yeah. Because therapeutic touch does not mean massage. It doesn't mean any of those things. Sometimes just holding somebody's hand or, rubbing their back, those kinds of things are therapeutic touch. You don't have to have a license to do those things. Okay. A nurse is caring for a group of patients who have requested the use of complementary health modalities. Which patient is not a good candidate for guided imagery? a pregnant patient, a hypertensive patient, a patient with post-traumatic stress syndrome, or a pediatric patient?
PTSD.
PTSD, absolutely. Okay. That is
Just
not somebody you want to take through guided imagery. How come?
They can live it all over again.
Absolutely. You're going to put them right back in the heat of the battle, and you don't want to do that.
Now tell me what you think.
What?
Said you can
You
ask
don't
him.
probably want to know where they've been at. That is probably
Where
not somewhere I can deal with or cope with. So so that is not somebody you want to take back to that, okay? Traditional Chinese medicine is used by many patients. Which statement accurately describes interventions offered by traditional Chinese medical providers? Acupuncture is used as its primary intervention, uses modalities based on the individual's needs, uses primarily herbal remedies and exercise, or it is the equivalent to medical acupuncture. Which one is true about traditional Chinese therapies?
B.
Absolutely. So, people who practice that, they do an assessment and all of those kinds of things on patients, just like we do in Western medicine. And then they base upon those assessments which modalities they need to use. Is herbs going to work? Acupuncture going to work? What kinds of things do we need to put into place to kind of help them? So definitely B would be your answer for that. Any questions on those questions? Any concerns that you guys have where you didn't quite understand the question or how you got to it? Yes, Kobe.
So I mean, I don't think I received an email for I don't know, did you send a study guide for
the test? No, I have not sent that yet. I will send
Okay.
that to you guys tomorrow, okay?
Okay. I didn't know. Cuz I just know the whole email thing. I just wanted to make
Nope, I
sure.
haven't sent that yet. And I will text you, Kobe, when I send it to make sure you get it, okay?
And
Because I know sometimes mine don't go through to you.
I was wondering, do you know much on uh the professionalism paper? Do you know kind of
I don't.
because I was looking through it today and I'm just having a hard time. I mean, I know where my sources are and I have the template for it. I'm just having a hard time putting it all together, I guess.
Okay. Where are you guys at, Reggie and Joe, with that? How are you guys doing with that professionalism paper?
I still have a ways to go.
Are you struggling putting it together, or like where Kobe's questions where he is having with it? Are you guys struggling with that? Are you guys kind of understanding what needs to happen?
Yeah, I understand what needs to happen.
Okay. So, Kobe, do you want me to have Brianna reach out to you on that paper to kind of help with that? Do you think that would help you?
Yeah, and
Okay.
I mean, she has the template and everything sent to us, but I guess I'm just having a hard time how to put it into my own words, I guess. So that's just the trouble that I'm having.
Well, and I think the whole goal of the professionalism paper is really to kind of take, things that you've learned, things, where your experiences, and then some of the research that you've done, and putting together what you see, what's expected of you in this profession, and kind of how you feel about that. And I think that's really kind of where she wants you to go with that paper. Am I right, Reggie and Joe? Is that what you guys understand with that?
Yeah. Yep.
Is that what you guys get from it too? So I think,
Yes.
Kobe, don't overthink it. Now I got him so flustered he left.
Both of them. Oh, there he is.
I just wonder if he isn't overthinking it and trying to overanalyze it.
Possibly. He's a smart guy, so he might be doing that.
Well, I think sometimes we do that. We kind of start overanalyzing things, and then we put way too much thought into it, and then we end up down the rabbit hole that we shouldn't be in.
Yeah. Yep. Been there, done that.
How is everybody doing with their catching up on homework and those kinds of things? I know Bree had sent out emails that there was some complications or something with the internet program and some of those assignments not, to and from wasn't working as kind of how she had hoped and thought, and because those are all due. Is that on Monday?
Yes.
Is that how it is? Okay. How are you guys doing with that? Everybody getting those caught up and kind of on track with that?
I'll put it this way. I'll be busy this weekend.
You'll be busy this weekend.
I got a lot to catch up on too. So
Finally.
I wonder. I will text Bree. I wonder what her thought is moving this test maybe till Tuesday. Because if we're allowing for the makeup homework to be done and prepared for on Monday, I don't want you guys to take away from study time either for the test. So I wonder if moving the test back until Tuesday would be an option. Just kind of giving you that day to kind of finalize everything and then moving on. So I'll text her and kind of see what she thinks about that and have her send an email out to everybody, okay? All right? Because I want you guys to kind of focus on that too so that you're not getting overwhelmed or inundated either. Okay?
Yeah, I have my study guide done for Bree. I've been studying that. I'm making note cards for the tables that I remember. I'm just worried about the paper because I'm terrible when it comes to, and I know I need to focus on my studying too, but I just don't want to get behind, and it's just papers are hard for me. So I just,
Do you think you're overthinking it?
yeah, yep.
So I think take a step back and, I think reread what the purpose of the paper is. And then
Okay.
make sure that what you're putting together focuses on meeting the needs or the requirements of the purpose of the paper. Okay? Not getting too caught up in those kinds of things and that kind of stuff, because I think sometimes we get overwhelmed and we overanalyze the details and we miss the concept of the situation. Okay? What truly everything has been put together is with writing papers and those kinds of things. And I don't think Bree has been really critical on the paper formatting. And I mean, we want it formatted. We want those kinds of things. But what we have found in the past, truly is that we've had students come into the nursing program that really haven't had to do a lot of paper writing. Getting to that point where, this is a professional communication. We need to talk, we need to put our thoughts and our words and our processes together to be able to communicate our thoughts and ideas in this professional realm. And so really that's what the paper is doing. We're really just trying to get you into that practice of putting your thoughts and your ideas and taking some research and kind of, supporting where you're at, because that's what's expected of you when you get into the nursing field, that we communicate professionally and our thoughts are thought out and they are evidence-based, and we can back those kinds of things up. And that's really the purpose of the paper everybody knows what professionalism is. We know what it should look like. We know that we all need to do that, but really just kind of looking at putting your thoughts and your words into paper and having this thought out planned and supporting it with some evidence-based information. And that's kind of really what it is. So don't overthink it. It's not going to be critically graded or anything like that. Okay. And then I will get my study guide out to you guys tomorrow. I need to finish putting the test together, and then I always base my study guide based upon my test questions and those kinds of things. Okay. And then do you guys want to get together then again on Sunday evening and kind of review again and those kinds of things? That way we can, clarify any questions that anybody has, kind of go over some of those kinds of things as well. So, should we plan on Sunday night at 7? Does that work for everybody? And I'll let Emma know as well then. And I will get these recordings uploaded and everything sent out to you guys so that you have access to the recordings from this week as well then. Yes, Joe.
Howdy, I missed what was it? I missed Monday or Tuesday. Anyway, is that uploaded already, or are you gonna upload that one?
I do not have it uploaded yet, but I will get that done probably tomorrow for you, Joe. Okay.
All right.
So I'll have Monday nights and then tonight's as well uploaded tomorrow night for you so that you have access to them. You bet. Okay. And then I will get my study guide together and then I'll finish putting my test questions and all of those kinds together. And then we can get together on Sunday night again and kind of review any questions or anything that you guys have or those kinds of things. Okay. Are you guys getting a little bit more accustomed to the test taking and the questions and how they're asked? Okay. Because I think once you begin to understand how test questions are asked, I think it will help you with studying and preparing for lecture as well. Because then you can kind of tune into, this is important information based upon the questions and how you ask questions and stuff. So, and then we'll go over some of those things again on Sunday night. Remember that we talked about previously after the last test. I give you no questions that I don't think are important. Review all my questions that I've given you. Review those questions in the back of your book, okay? I do not ask you to do anything that's not important. I will not waste your time. So if I have talked about something, I've told you to review something, then you really need to pay attention to those things because I'm not going to waste your time. I'm going to tell you what I want you to know. Okay? All right. So focus on those kinds of things. I will get my study guide out to you. And then we will review on Sunday night as well. Okay? All right. Any other questions for me? All right. Thank you guys for all meeting with me tonight because yesterday was a bad day at the clinic. I didn't leave until after 6:30, so I would have never made it on time. So, and then I will get everything sent out to you tomorrow night, and then we'll get together on Sunday again. Okay? All right. Good night, everybody.
Yeah.